Good day, baby yum yummers. We are so thrilled to be back on your screen, and today we are talking about the horrible feeling when you are alone at night. Why it always happens in the middle of the morning when everyone else is asleep, we don't know, but it's a challenge to manage your baby or your young children's fevers, teething pain, and all kinds of aches and pains, and you can feel so desperate and lonely in those hours. But today, we have Dr. Ninke Fourie from Netcare Birthwise with us to share with us what to look for, how do we help our children, and how do you make the right decision in those dark hours of the day. So, Doctor, thank you so much for being with us here today.
Thank you for inviting me. It's a pleasure.
And tell us about Netcare Birthwise, please.
Yeah, so I work for Netcare Birthwise. We are an obstetrics practice. We are focusing on helping patients by being a medical aid rates practice. So we want to provide quality care, but at medical aid rates. So ultimately, you'll get the private experience, but with as minimal as possible out-of-pocket payments. And we're a team. We're a multidisciplinary team. We consist of GPs, obstetricians, midwives. So everyone has their part to play in your journey.
That's amazing. And it's a one stop and one solution place for a mom or a parents who want the best. And it sounds amazing, especially now that you say it's a team. Because sometimes I think you can feel you're being sent from pillar to post and no one's talking to each other. And in your case, it's one place that you go to.
Yes, yeah. So we, and beyond us, we've also sort of partnered with a lot of specialists within the hospitals who sort of provide maybe like in your antenatal journey and even beyond, specialists who work with us as well. So that we all like one communication channel.
That's incredible. Thank you so much. Now, Birthwise, and I'm looking forward to hearing your wisdom because we, as parents, we are so, we do our best, but sometimes you can be so worried when it comes to medicine and what to choose and when to administer and how much and so forth. So let's talk about what is the main difference between a syrup and a suspension.
Okay, so in general, medication, like it comes in many different forms. So the big difference between a syrup and a suspension is if you think about a syrup, you must almost think about it as, when you mix sugar into water. It's completely dissolved. The active ingredient is completely dissolved, and each part of that syrup contains the exact same amount of active ingredient.
Okay.
Whereas in a suspension, your medicine is in small particles. So those particles are suspended within the suspension. Okay. So ultimately what can happen is this can settle to the bottom. Say it stands on the cupboard shelf for a while, and then if it's not shaken, your child might not get, there's not the same amount of medicine or active ingredient within the suspension. Sometimes suspensions are also a little bit thicker than syrups. So that syrups are more smooth, whereas suspensions are slightly thicker. But the biggest difference is sort of your distribution and what your active ingredient within it looks like.
Okay.
Yes.
Makes sense. So what does it mean when we talk about an active ingredient? Now, does this distribution of the active ingredient in the syrup versus suspension differ? You've explained it to us, but if you had to talk about the active ingredients, as parents, we always hear about it. But what does it mean?
Yeah, so basically the active ingredient within a medicine is the thing that does the job, right? So everything else is sort of the vehicle which accompanies the active ingredient when giving it to your child. So for example, when we're talking about treating pain or fever or teething, we want to use paracetamol, which is your active ingredient. So if you're thinking syrup, each spoonful of that syrup will contain the same amount of the paracetamol. Whereas with the suspension, that's also true, but just given that you've actually shaken the suspension very well, then you can give the correct amount of active ingredient to your child.
Okay.
Yes.
Okay, great. And how do I know what dosage is suitable for my child and the specific ailment that we're dealing with, because it could be teething, it could be a fever, and fever is so tricky because you don't really know what is causing the fever necessarily. So how do you know how much to give?
So in general, we would always advise that you go to the medicine packaging or the insert leaflet to make sure that you check the correct dosage. or whatever your healthcare provider has provided. But especially when we look at kids, your kids' dosing is always dependent on their age and their weight.
Okay.
So my answer to this would always be check the package insert, make sure you either check it based on the weight or the age of the child. And then irrespective of the ailment, paracetamol is always dosed standardly, just purely based on age and weight.
Okay.
Yes.
So that helps, especially if you then can identify whether it's a syrup or a suspension, and then going back to the packaging. So is there a difference when it comes to the way the dosage works when comparing syrup versus suspension pain medication?
So not really. So the short answer is not really. What's nice about suspensions is that as kids get older, you can focus more of the active ingredient in a lesser volume.
Okay.
Whereas with a syrup, you can't really do that. So for younger kids, where we want it to taste better and you want like a set, you want a certain dose in the syrup. Whereas with the suspension, like I would almost say, like when kids are almost like up to the age of less than 6 years old, it would really be very similar in terms of the amount that you're going to give. But as kids get older, suspension's dosage can actually become less as the active ingredient can become more concentrated in a lesser volume, if that makes sense.
Yes, yes.
Yeah.
It does. And I think that's why you will always say that we need to follow what the doctor said.
Exactly, yeah. So, and some medicine just unfortunately, it can't be, that active ingredient is not stable in a suspension form, or it can only be in a syrup form. So you just, sometimes if what's prescribed is probably sort of what you need to go for, because that's what's on the market for this specific active ingredient.
Okay.
Yes.
And how long does it take for the medicine to work, and how long does the pain relief last for? Because sometimes you're so worried, you've waited and tried to see if you can manage the symptoms, but now you've reached a point where you can see your child is really struggling and everyone wants to, cry together. Or you are so worried about the fever that's all of a sudden it's spiked and you want to get a quick relief.
Yeah. So in general, when we talk specifically now with regards to medicine containing paracetamol, which we would want to use for fever or pain or teething ailments, once you've given the correct dose, it usually takes 30 minutes before the effect will settle in. And then it usually lasts for around about 4 to 6 hours. Okay. So that's why you can also dose the medication every 4 to 6 hours, just not exceeding the recommended dose for the whole 24 hours.
Okay.
So we usually, if your child is not, if by 4 hours the fever's back or they're complaining of pain again, you can give another dose, but just make sure you always check what is the total amount that they can get in 24 hours.
Yes.
Yeah.
And probably try to figure out why the pain is not going away.
So we don't want to just treat symptoms. You want to know what the cause is.
Yes.
Initially, you get to know your child and it's worth trying, but we usually advise to say if your fever or the pain is not settling within 2 days of self-medicating it, you need to seek medical advice and we need to find out what the cause is behind all of this, and it might need further workup or treatment.
Yeah.
Yeah.
And medical advice, true medical advice, not just a search online.
Yes.
So making sure you get the right information. So giving a child, especially the younger ones, medication can be such a huge challenge, especially if the medicine doesn't taste or smell nice. Is there a difference in taste and smell when we compare syrup and suspension medicine, and what is the reason for this?
Yeah. So I think drug companies have come a long way, and they really notice that as parents, we really struggle to get medication into our kids. So I think syrups, once again, is a bit smoother and sweeter than your suspensions. But in general, a lot of colorants and flavorants are added to make it taste nicer and be more palatable for kids. So I guess if it's marketed and on the market to be given to your child, the companies do really try and make it palatable and easy to take for your kids. But if I have to choose one, I'll probably go for a syrup with a younger child. It's smoother, there's no bits that you can bite and it will be chalky or unpleasant. But usually in general, the flavoring and the colorants do at least make it look and smell a bit more appealing to a kid.
And helps us to help our children because, especially in the early hours of the morning when everyone's desperate and no one wants to be in the situation, you take the help you can get. And I think it also, from a color point of view, you can tell a story around it. And as parents, we come up with the most amazing ways, right, to give our children medicine. Okay, so it is important to look at the storage and safekeeping of any medicine, the instructions that is given on the packaging. Is there something specific to note considering the way we store and treat syrup versus suspension?
Yes.
Especially if it's been standing on the shelf or in the cupboard for a long time?
Yeah. So in general, when it comes to medication, you would always want to make sure that the medication that you're going to use is not expired. Okay. So whether it's a syrup, whether it's a suspension, just check that it hasn't passed its expiry date. In storing medication, syrups and suspensions, you want to store it in a cool, dry place and avoid direct sunlight to the bottle. And then the last thing is syrups you can use directly, given it was stored correctly and not expired. But with the suspension, you want to shake it before, because it has these particles that can settle at the bottom. And then ultimately, if you just give the top bit, you might just be giving some solution that's used to mix the medicine, but you don't get any active ingredient within it. And then lastly, I guess you can always just use this opportunity to tell parents to be vigilant for storing medication out of reach of children. So wherever you store it, it needs to be in a place where your kids can't reach it. And then I guess if you do pour the medicine or it looks different to when you bought it, rather discard it and get a new container.
Makes sense. And I think shaking the suspension one is really important to read. Again, just read the instructions, right, and shake it before use. Yeah. Thank you so much, Dr. Fourie. Is there anything else that you feel that's important for us to know?
I think basically when it comes to all these medications, make sure you're informed, choose a good, trusted source of your information. If you have a good healthcare provider, also trust the advice that they give and try and follow it. But when you are stuck, just refer to the leaflet. The medicine containers usually explain everything very nicely. Your dosage will be on there. Your from what age it's safe will be on there. And if ever you're worried, seek medical attention.
Great. Thank you so much, Dr. Fourie. We appreciate you being here with us at BabyYumYum. And let's remember, besides the fact that there's a difference between syrup and suspension and all the other options on the market, a big hug, lots of love, patience, and just support from your community helps. And that's why we are here as BabyYumYum. So enjoy your parenting journey. You're never alone. And let us know what you think. What has been your biggest obstacles when it comes to managing pain and teething and any other ailments for your babies and young ones? And thank you for watching, and we'll see you at babyyumyum.com.